And good morning. It's August 31st, 2023. I'm Dr. Duke Majan, CEO and founder of the Duke Spine and Duke Joint Institute. Our patient here is from Minnesota. She's traveled to Florida to have the Duke laser disc repair, endoscopic, 2 discs that are herniated, degenerated, fixed. We've also done the Duke plasma rhizotomy. We just finished that a short while ago in the back of her neck on the left side for facet joint pain. Now we're treating her herniated, degenerated disc symptoms. All right, so we're going to get started. Yeah, but I'm okay, actually. She doesn't have a lot of resistance. Shot? All right, perfect. So there's 6-7. That's fine. Even though she has muscle twitches, shot, AP. So the first thing I'm going to do is get into this disc. And to do that, I have to use a needle. And I'm going to use my APN lateral fluoro. So I'm a little bit to her right. I want to reposition. Shot. All right, let's go back to lateral. Yeah, you're right. I am fighting her muscle a bit. But I do see the tip of the needle is in the midline, at least now, which is good. Perfect. That's fine. Shot. We're inside the disc. I could feel it. AP, Coker. So the first step in the Duke laser disc repair is always placement of spinal needles, 18 gauge. And we use these needles for 2 purposes. Number 1, to safely navigate to the target location, which is the herniated degenerated disc. And number 2, to inject dye, actually 3 purposes. So we could do a discogram. And number 3, to act as a conduit shot for the guide wire. The guide wire is what I'm going to use to access the disc with the endoscope. I use a guide wire, dilator, and then my endoscopic tube. Shot? Oh yeah, I felt it go. Look at that. That's the dye we're talking about, and this dye is in shortage, by the way. You can see it leaking out the back of the disc through a big tear. We're here to fix that tear. And what I mean by fix the tear, I mean, let's have some num-num. Actually, I'm going to do the C4-C5 next first. I'll do a little num-num. Let's put some num-num so it starts working. That will make Dr. Berndes happy. Num-num is numbing medicine, Novocaine. I do want to say a few things. First of all, this patient's daughter is here, but she has another daughter who's in Maui, who's watching, right? Megan. And we want to do a shout out to Megan. Hi, Megan. Welcome to our live stream. We're going to take great care of your mom. She's a lovely lady. All right. Next, I'm going to access C4-5. Everyone agree? Shot? 4-5. It's early in the morning in Maui. Maui? Isn't that the one Lahaina in Maui that got, there was a big fire. Poor people over there. I feel horrible for them. Shot? I went to Lahaina many years ago. AP? Beautiful place. Quick shot. Thanks, Luis. Looks perfect. Lateral. So the tip of my needle is right in the middle of the spine. You can see it on that AP view. Now I need to advance it into the disc. Shot. Uh-huh.
My oldest son was in Honolulu.
Shot. Your oldest son is in Honolulu. Shot. All right, we are now inside that disc. Shot. At this point, I could do a discogram. We're going to make 2 little cuts. It's going to look like she came to Florida and a vampire got her. Shot. Shot. So it's trying to get the dye to come out. Shot. Yeah, let's see here. Let me try something. I think there's just some stuff in the end. I want to clean it out. If you have questions, feel free to ask. That's what we're here for. We're here to answer your questions and show you surgery, how it's done. Now I want to point out the alternative surgery for this woman would be a multi-level fusion. I just can't get it out. Nope. There's so much scar tissue in this disc space. Hold on. Well, we'll try it later. So the scar tissue is blocking the dye from exiting the needle tip and doing a discogram, which is quite interesting. The scar tissue comes from inflammation. She has inflammation in her disc. Now, other surgeons may think about doing fusions. That's typically what they would do. Shot, let's make sure the needle isn't moving. Good. But fusions, in my opinion, are an old-fashioned technology. I've done 1,000 of them myself. They're dangerous. They have risk of complications, high risk, 50% complications with fusions. And the alternative, which is what you're watching here, Duke laser disc repair, is a much safer procedure. In 1,700, oh, shot, I came out. Unbelievable. It literally pulled on the guide wire. No, we're fine. I have to replace this. We're going to have to replace this one. In 1,700 surgeries, we've not had any complications to date, which is really good. Huh? No, I think we're good. Shot? So, I just need to get back into this disc that I left. Shot? Feel like I'm right on the bone, and I am. I need to come down a little bit. Shot? That looks pretty good. Let's make sure we're in the middle. Give me an AP. I'm going to keep my hand here. So, I've told you guys before, that's perfect. When you take your needle out, be sure not to take your guide wire out. And that's what I just did. I accidentally took the guide wire out. So it's because the needle caught at the tip of the guide wire and pulled it back just a little too far for me. Shot? So there's always going to be some pull. Shot? And you want to make sure as you're taking your needle out, shot, it doesn't pull the guide wire out. So you got to hold the guide wire, and it's a little slippery, by the way, which I'm doing right now. Shot. And then your needle always catches on the tip of the guide wire, but that time we're good. Shot. So we preserve the position of the guide wire within the disc. Now we're going to come down with our dilator. If you look at the dilator, it's got a tapered tip, and the reason for that is it spreads the fibers of tissue under the skin. Everything under your skin has fibers: muscle fibers, collagen fibers, connective tissue fibers. The only thing that doesn't really have fibers is your skin. So the skin has to be incised. Incision means a cut with a sharp object, like a scalpel. That's why we have to do an incision. Shot. But once you get past the skin, you don't need to really cut below the skin. If you're doing endoscopic surgery, we don't cut anything, we spread it. All right, we've lost about 2 drops of blood, and we're now entering the disc. Let's get an AP view. We want to make sure we're in the midline, so I'm going to get an X-ray. Will you call Nikki or find her? She's supposed to come in here. Nikki. Looks perfect. We're right in the middle. I love it. You can see her dental work. By the way, I like to start with the most difficult level usually. So 2, 3, 4, 5, 6, 7. You can see that 5, 6 is fused. show us the bone in the front of 5-6 on the x-ray. Take a look at this x-ray. See that bridge right there? That's a bridging osteophyte, meaning that those bones have been fused together. I will need some inline. Shot? Making our way to the back. Beautiful. This disc is extremely degenerated, by the way. So what I'm going to do here is extremely limited in what I can do. That's good. We're now at the back of the C6-7 disc. Now look at this, folks. The entire surgery is going to be done through a skinny little tube. It's called a tubular retractor. It's a retractor because it retracts tissues to the side so the surgeon can get in and do surgery. It's tubular because it's a tube. No magic there. All of our equipment is FDA approved. All of our supplies are FDA approved. People ask me that often. Is the Duke laser disc repair FDA approved? FDA does not approve surgeries. It approves drugs, supplies, equipment. Any questions so far, Sanjay?
No questions.
Let's run our video on why do disc herniations cause pain. All right, Dr. Berndes, we're going to need a little inline traction, my amigo.
Playing educational video.
Shot. All right, welcome back. Now you can see why these disc injuries cause so much pain. It's all about inflammation. Now there's lots of names for disc injuries. Some people say herniated disc, some people say ruptured disc, some people say slip disc, prolapse disc, extruded disc, bulging disc, protruding disc, but they're all the same. They're all a tear in the wall, and the names are inconsequential. They really have zero meaning, zero prognostic value. Okay? They're just different names used by different doctors over the last 200 years. So don't get confused. The only thing that's really substantially different is what's called degenerated disc. And even then, the degenerated disc, you don't do anything different. We do the same treatment because the basis of pain and suffering from a degenerated disc is the same as that from a herniated disc. It's quite literally the annular tear, even in a degenerated disc. So we don't find that it's necessary to implant metal in people's spines, whether it's an artificial disc or it's a fusion, because we found that implanting metal doesn't improve the outcomes. As a matter of fact, it makes it worse. So far, we've removed about 6 pieces of herniation there. You can see the angle of her disc makes it challenging for us to do the surgery. There's another piece. These pieces of herniation are working themselves out from deep in that crack. So really, the tube is very important. It's a conduit. And you don't get this in other types of spine surgery. You don't have a conduit. All right, I'm getting my feet wet. How is that happening? I didn't sign up for a bath today. All right. Any questions from our audience?
We have a question from Jonathan on YouTube.
Hi, Jonathan. Welcome.
Hello, watching from UK. I have had C6-C7, C7-T1 ADCF,
Yes.
and C5-C6 ADR. Still in pain.
Yeah.
I have now got left side facial numbness
Oh, no.
and pain at the base of the neck. Could this be another herniation?
Yes, Jonathan, it's most likely not a herniation that's causing your pain. It's most likely facet joint pain. But what you should do, Jonathan, is Sanjay will put a link right now in the dialog box. It's mri.dukespine.com. Send us your MRI. Let us do a quick telemedicine visit with you, and I will tell you exactly what's causing your pain in that telemedicine visit. And then we can fix it as well. Duke Spine Institute is the only spine center in the world that does Duke plasma rhizotomy for facet pain to eliminate pain permanently that you're experiencing. Great question. Unfortunately, we call it adjacent segment disease, and that's what you have. All right, these are bone spurs I'm removing. And people ask me, are you going to get all the bone spurs? The answer is absolutely not. We're not going to get all the bone spurs. Are you going to get all the herniation? Absolutely not. We are not going to remove all the herniation. People ask me, why does my spine still look bad? The reason is simple. We're not here to make your spine look good. This is not plastic surgery of the spine. Or as Dr. Berndes says, cosmetic surgery of the spine. There is no reason to do cosmetic surgery of your spine. People can't see your spine unless you show them pictures of your MRI, and if you do, I question other things about you. But that said, we are able to eliminate symptoms because we target the symptoms. What causes the symptoms? Specifically, facet pain, it's going to be the medial branch of the dorsal ramus is the nerve responsible for all that pain being transmitted up to your brain. Following me? So, if we eliminate the medial branch of the dorsal ramus, you eliminate the source of pain. I do want to make an announcement. Duke Spine Institute has made history. Yet again, we did the first shoulder Duke plasma rhizotomy yesterday. All right, this is a patient who has arthritis in her shoulder, severe pain and discomfort. She's been told by 3 surgeons she needed a shoulder replacement, but instead we did the minimally invasive Duke plasma rhizotomy. Dr. Patel, myself, Dr. Davis, we're the first in the world to do this. It's developed here at Duke Spine. Essentially, under twilight anesthesia, or no, general anesthesia, she had a 20-minute surgery where we went in and deadened all the pain nerves to the shoulder joint and eliminated her pain. She came back today, no pain medication. All the anesthesia is worn off, obviously, a few hours after her surgery. She came back today and had 95% of her shoulder pain is gone. She still has trouble moving her shoulder because it's so stiff and the muscles are atrophied around the shoulder. But this is the first in history of anyone ever doing rhizotomy, plasma rhizotomy, which is what we do, to deaden the pain nerves around the joint that cause pain. and her pain is gone. I want you all to know that, my team here. I don't know if you guys heard this, but I was just over there with Dr. Patel this morning, and this is our first case in history. So we've done our knees, we've done hips, and now we've done shoulders with the Duke plasma rhizotomy, and we've been equally successful with each one. I just want to congratulate our team. So if you know somebody that needs a knee surgery, knee replacement, don't do it. Get an opinion at Duke Spine first. You're going to want to see Dr. Patel. He's our physiatrist, or Dr. Davis. He's our orthopedic surgeon. All right, just about done here. I need another, I don't know, 10 seconds. There's really not much herniation left. It's gone. So we're done.
Right on, please. Thank you.
She did great. We got one more disc to go. Now the next disc is not as degenerated as this one. This one is substantially degenerated, but the next one is more preserved. And I don't know how long that'll take me, but another 10 minutes and we'll be done. All right, we put in some antiseptic to minimize risk of infection. Take. And now I'm going to remove the tube, and I'm going to get ready to move to the second disc, which is the number 4-5. We've already fixed 6-7. Any questions?
No questions.
All right, let's show the audience how the Duke laser disc repair works.
Playing educational video in 3, 2, 1.
Shot. Welcome back. You can see now how the Duke laser disc repair works. We go in with a laser, endoscopically find the tear, and clean out all the herniations. Can't be done without the endoscope, can't be done without the laser. It's called the Duke laser disc repair. We published it in the medical literature after peer review, 12 years ago, and we've been publishing since. Now here's the incision. You all see that? What a difference compared to a fusion.
Yes, we do.
There's no internal damage whatsoever. It's just the skin incision, 4 millimeters. We're going to do our second. I'm telling you, it's going to look like she got attacked by a vampire when she leaves here. She's going to tell everybody, I went to Florida and I got attacked by a vampire. I think we're the only place in the world that has a vampire mark at the end of the surgery. Right? I mean, who else does cervical surgery through a 4 millimeter incision? And if you have 2 of them, you have the mark of the Duke spine vampire. I like that. You know? We're the only ones in the world that can do something like that. Of course, anybody can cut themselves, but to actually have spine surgery done through a 4 millimeter vampire bite incision. All right, any questions?
No questions.
Okay, so we're right at the disc again. Shot. And let's get a quick AP. I feel it going in. By the way, an AP is a front-back X-ray picture. Watch your hand. Watch your hand. Shot. Perfect. We're right in the middle. Show us the middle. Why is it important to stay in the middle when you enter the disc through the front? It's important because, yeah, let's go lateral, please. Because if you get off to the side in the cervical spine and you go through the longest colli muscle, then you can damage the sympathetic trunk. And if you damage the sympathetic trunk during spine surgery on the neck, the patient will have what's called a Horner's syndrome. Horners. Not a horny syndrome, but a Horner's syndrome. There's a difference. That's right. Meiosis, anhidrosis. Basically, ptosis, right, a droopy eyelid. All right, we are at the back of the number 2, 3, 4, 5 disc. Everyone agree? I want to welcome Nikki to the operating room. How are you? Very good. Now, Nikki, you get to see where we make all this incisions on people that you get to see in clinic afterwards. You get to see where the magic happens, right? Isn't that why people come to Florida, to see the magic? Yeah. Huh? This is a different kind of magic. Mickey isn't the only one. I made a 3.5 millimeter incision. So I need to make my incision another 0.5 millimeter. Otherwise I won't get the tube in. So I just added a 0.5 millimeter. So we're at 4 millimeters now. Just big enough for the tube. Shot. Any questions from the audience?
No questions.
Shot? Okay. Very good. Yeah, we're ready. Go ahead. We're going to advance the tube. I got it. We're going to advance the tube into the disc over the dilator. Shot? Oh, dilator is coming back. That's why you got to always pay attention. Things can happen quickly in surgery. So there's so much inflammation in this disc that it's pushing my dilator out as I kind of shake it a little bit. Shot? Pull, distraction, shot? Beautiful. Shot? Almost done. Perfect. Perfect, perfect. Show us the position of the tube, Jordan. Right, go ahead and get another x-ray. Show us the take it out. Position of the tube. Show us the back of the disc. There's the back of the disc where the tear is. Show us the position of the tube. You can see the tube is right where the tear is. So far, we've lost about 5 drops of blood, the whole surgery. That's it. There's no scar tissue from this surgery except the skin. There's no bleeding. We have a few drops of blood. That's it. Some ladies lose more blood shaving their legs or their armpits. This is bloodless surgery, but it's not vampireless surgery. I thought that was funny. Good. You're laughing. You can work here. You'll do great here. As long as you laugh at the surgeon's jokes, you'll fit in. All right, any questions, Sanjay?
No questions.
Excellent. Our audience is quiet. It's unfortunate. We broadcast these incredible surgeries over the internet, and we have so few people that know about it or participate. It's a great opportunity for people to ask questions and get answers. Actually, it's a better opportunity than going to your surgeon. Why? Because most spine surgeons don't have the answers. They can't give you the answers. You ask them questions, they'll give you an answer, but it may not be the right answer. Or they won't even give you an answer, or they won't even give you the time. But here I am, a neurosurgeon, making myself available to the public over the internet during surgery, letting all of you guys watch, and yet it just stumps me how Facebook and Twitter and LinkedIn don't value this type of programming more. If I had my boobs hanging out of a bikini, I would get 1 million more hits. But when I show something that's cutting edge, scientific, medical, that could help millions of people, it gets shoveled off to the side. That's unfortunately the priorities of our society today. It's wrong. It's not what I would do, but I can't fix it. Unless they give them millions of dollars to promote my videos, which I'm not going to do. All right, that is the spinal cord down there. You guys see it? The white thing?
Yes, we do.
That's a little bit of fibers of the PLL and then the dura. So we are literally right on top of the spinal cord. People ask me, how can you operate right on top of the spinal cord with a laser? Well, the answer is the fluid. And of course, I'm a neurosurgeon. So as a neurosurgeon, I'm trained to do this type of surgery. That's what I do. I do spine surgery. I do decompression of the spinal cord, nerve roots, etc. That's what neurosurgeons do. Unfortunately, a lot of neurosurgeons have not kept up with advances in technology, and they've just want to keep doing fusions and artificial discs because they pay better. Unfortunately, patients become the victims of surgeons' greed. And we all took an oath as doctors that we were going to always do what's best for our patients. But a lot of these surgeons don't do that. They just do fusions and artificial discs or laminectomies, then fusion. And that's why I'm here, because I want people to know the truth. I want them to know that there is a better way. You don't have to have a fusion. I used to do only fusions and artificial discs before I learned endoscopic from the Koreans 17 years ago. But then Dr. Sang-Ho Lee pioneered a new technology, endoscopic surgery, anterior cervical endoscopic surgery, through the disc, transdiscal. That's what transdiscal means, through the disc. And Dr. Sang-Ho Lee in Korea is the one who taught me the approach. He probably doesn't even remember me. He's retired now. I was nobody at the time. I still am. But at least I do the surgery now. And Dr. Gun Choi, who was his right-hand surgeon, neurosurgeon from Korea, they're the pioneers of this technology. Not the laser. The laser's mine. The debridement of the annulus is mine. But they would do a herniectomy where they would take out the hernia. Look at that giant herniation right there. It's stuck down with the scar tissue. You see that? As soon as I release the scar tissue, it's going to be coming out. It's stuck down right here. You see that? It's literally pushing on the nerve in her foramen, right where the nerve is. Okay? You all see the spinal cord is in the middle. The nerve comes off the spinal cord and goes out the foramen. And this is a herniation literally sitting right on top of the nerve, scarred in there from years and years of inflammation. Okay?
We have a question coming from Gary on YouTube.
All right.
How do you decide which side to enter the disc from?
How do I decide which side to enter the disc from? I enter the disc in the center of the disc. However, which side of the neck I go is always opposite of the side of the worst arm pain, okay? I go the opposite of the side of the worst arm pain because it's just easier to go across the back of the disc. That's why. And I want to make sure I get that area good. All right, there's the spinal cord right there. And then the spinal cord ends here and it becomes the nerve. The nerve. And the nerve is just underneath this herniation right here. So I got to remove a little more herniation and we're good. This is scarred up herniation. Scar tissue sitting on top of the nerve. in the foramen on the right at C4-5. Okay? This is a foramenotomy, basically. I'm opening the foramen, getting the pressure off the nerve. There's still a little bit of herniation there. I got to be really careful here. I don't want to get too aggressive. I've already removed a lot of herniation, and I've decompressed it, and you want to be careful not to take too much. So as you watch, I'm bouncing because I'm checking about the recoil. If there's no recoil, there's still more scar tissue and herniation. If there's recoil like that, that means that that's the nerve root just underneath there. So I'm pretty much done with that foramen. Almost done. I need 2 minutes. I'm done, Dr. Berndes. I hope you know that. Are you prepared? Awesome.
We have a question from Andrew on
Who?
YouTube.
Who?
Andrew on YouTube.
Andrew.
Yep.
All right, Andrew, welcome to our stream. We
When,
got 1 minute left.
when the annulus heals after surgery, what's the quality of the new tissue like?
Oh. All right, the annulus heals after surgery. That's correct. After my surgery, Duke laser disc repair. What's the quantity of tissue left? We're not removing any tissue except we're not taking the disc out. So whatever disc the patient starts with, they still have. The only thing we're taking out is the herniation and the some of the bone spurs and the scar tissue in the tear and the granulation tissue and the calcification. Look at the nerve down there. You guys see it? That's the nerve
Yes, we
right
do.
there. And this is sitting on top of the nerve. It's all scarred herniation. Almost done. This is the last of it. Oh, look at that herniation coming out. Oh, yes. That's the beauty of this surgery. So it's not just about lasering. It's also about the effect of the laser on the fluid. It literally is like a hammer, not a hard hammer, but a gentle hammer that releases pieces of herniation. It's wonderful. Look at that. That is beautiful. This is called a foramenal herniation because it's a herniated disc located within the neural foramen, pinching the nerve. I'm just about done. I may have to cut this one in half. It's too big. Let me see if I can grab it out. I don't know if I can grab it out. I'm going to try. I don't think so. Yeah, I think it's either stuck in there or it's too big to come out through the tube. So I got to cut it in half essentially. How are we on fluids? Oh wow, there's a piece right there too. All right.
We have a question from Jonathan on YouTube.
Uh-huh, sure.
Thank you for your advice.
Oh, thing is huge. I
If
don't know.
my facial numbness is being caused by facet joint syndrome,
Your facial numbness is not being caused by facet joint syndrome.
is
It's
it
not being caused by a herniated disc.
is it possible that this is also the cause of continued numbness in my hands and feet?
The continued numbness in your hands and feet is likely because the surgeon did not do good surgery, which is why we tell everyone, come to Duke Spine. Get good surgery. Don't be left wondering why you're still suffering, because your surgeon did what they want to do, not what they should have done. That's the best advice I can give you.
We have another question from Andrew on YouTube.
Uh-huh.
When the annulus heals after the surgery, what's the quality of the new tissue like?
The quality of the new tissue is excellent. It's all collagen. Collagen is what the annulus is made from. Yeah, I'm trying to grab this piece of herniation, but it's too big. It will not come out. The annulus fibrosus is made from collagen. When it heals after this surgery, it heals with collagen. So we're healing it with its natural components. We're allowing it to heal. See these things here, these are herniations. They prevent the annulus from healing. As long as this herniation is there, the annulus will not heal. So my laser removes the herniation and it lets the annulus heal. It's impossible for the annulus to heal as long as there's a herniation there. Everybody thinks the disc herniations heal on their own. They don't. They never heal on their own. You can see what I can see. However long it takes me to get this out. I would convert him to propofol or something. Man, I cannot get those things out. They're stuck. The herniations are so scarred down from all the years, they don't want to come out. So I have to actually use the laser to release them. Here they come. I have to use the laser to basically cut them in half, and then that releases the part of the herniation. You can see there's so many pieces. So the surgery is not just about laser or endoscope. It's really about a combination of things, techniques. There's a piece. That should be the last one, hopefully. We'll take a quick look and make sure it is. The surgery is really about, number one, a great view of the back of the disc where the herniation is. Number two, the pulse, the pulsatile nature of the laser, how it creates a pulsing action that literally mechanically disrupts the herniations and pushes them out from where they're nestled in there. I don't think I got it. And of course, how do you manage any blood loss? Well, that's done with the irrigation as well. How do you make sure the laser doesn't overheat the tissue? You use constant cold irrigation. That's what we use. It's just killing me that herniation is such a pain in the ass to get out.
That's why the disc never happened.
Yeah. Luis is right. All the scar tissue is why the discogram never happened, because we tried to push the dye out and it wouldn't come out. It's just a bunch of little pieces here.
We have a question from Megan on Facebook. Is there anything a patient can do to prevent further herniations after the surgery?
Yeah, that's a great question. So how do you prevent reherniation after surgery? Well, you have to restrict your lifting and restrict your physical activities for 1 year until the disc is healed. It takes 1 year to heal the disc. This is true of any surgery. All spine surgery requires restrictions.
We have a question from Andrew on YouTube.
Sure.
Are you using some kind of control to control the laser power?
Yes. Yes, the laser is controlled at the machine that generates the energy. The laser power can be controlled by an operator, a technician. And today's technician is Oscar. So Oscar will modulate the amount of energy coming out of the laser. We have a presetting for cervical, and it's 20 usually. This is it right here. This should be the last of the scar tissue. Look at the scar tissue though right here. This is all scar tissue. This is why the discogram material wouldn't come out, is all this scar tissue from chronic inflammation. What is chronic inflammation? It's basically inflammation, your body attacking the herniation, creating scar tissue over the years. This inflammation, this scar tissue is at least 20, 30 years old, at least. So this has been going on in her spine for many, many years. Many, many years. All right? I think I'm just going to take another quick look and we should be done. We don't really take scar tissue out normally, but when it's holding in a herniation, that's when I go after it. That should be it right there. Grab her. All right, I'm going to irrigate and we're pretty much done.
Lights on, please. Thank you.
All right, type up your questions. I'll be happy to come and answer them for you. Let's go ahead and we'll go ahead and come out, and then we'll go to a testimonial while I head over there to answer questions, all right?
Copy that.
You can see the two little incisions. You see that there, Sanjay?
Yes, I do.
They're tiny. This was a vampire with small teeth. 4mm teeth. All right, very good. Great job, everyone. Go ahead and go to a testimonial, Sanjay, and I'll be over there shortly.
Playing test.
And good morning, I'm Dr. Ara Dugmajian. It's August 10th, 2022. I'm here with one of my patients who traveled to Duke Spine Institute because she had 3 herniated discs in her neck. They were causing problems for her, like neck pain and weakness and numbness in her arm. And she just underwent the Duke laser disc repair yesterday, less than about 24 hours ago. And she's here today for her post-op day 1 check. How do you feel?
I feel amazing.
Good. You want to tell us, did the surgery help you, the Duke laser disc repair, and how did it help you?
Absolutely. I have 0 pain. I am not on any medication, even the ones you gave me. Don't need my muscle relaxer, don't need pain medicine. I immediately had all my strength back. All my fingers feel just like normal. I'm back to normal.
And you're actually wearing an outfit here. What is this outfit?
Yes, this is my work uniform. I came directly from work here. I went to work at 5 a.m. this morning after surgery at 7:30 yesterday. I reported here. So
you're right.
Went right back to work.
Yep, and had you had a fusion done, an ACDF, you would have been out of work for how long?
I don't know, because nobody offered me a fusion. They absolutely refused to fix me.
Well, if she'd had a fusion, she would have a huge scar on her neck, which you don't have. Show them your scar. How big is that?
4 millimeters?
4 millimeters. And you would actually be out of work for about 3 months with a fusion. Yikes. 3 months minimum.
Oh no, can't do
and
that.
Yeah, that's assuming it went well. And you can actually see in this video here the comparison between the Duke laser disc repair and a cervical fusion, which is a far more invasive surgery with a metal plate and cages, and you lose movement permanently. Have you noticed how your movement is since you had the Duke laser disc repair? Is your neck movement good?
Yes, I'm able to nod and I have full range of motion again, very carefully. And I'm able to walk normally. Right before surgery, you might have noticed I was waddling around, and I can take my normal steps again in a straight line. There's no dizziness. I don't have to hug the wall. It's great.
Yeah, the reason she had balance problems is because her spinal cord was getting pinched on by the herniation, which we got in there. And when you watch the video, you actually see there's a herniation pushing on your spinal cord. And I use a laser to remove that herniation and get the pressure off your spinal cord and the nerves. So I'm very happy with the results. Your surgery went perfect. We lost just a few drops of blood, and here you are the next day back to work, and that's incredible. This is why the Duke laser disc repair endoscopic surgery is so amazing, is people can have a great result, have low risk of the surgery, and be back to work the next day if they want to. All right, so what kind of symptoms did you have before your surgery? How were they affecting your life besides your balance problems?
Oh, I had severe pain that would make it to where I couldn't do my job. I'd have to have my coworkers repeat things to me often because I was in such pain I couldn't concentrate, couldn't listen to them. I had to be very careful walking around the office. I'd ping pong down the halls. I had trouble typing, lots of typos because I couldn't feel half my hand most times. I wasn't able to drive a bus at all. It's very dangerous when you can't have a grip on your steering wheel, can't reach properly for the controls when you have pain that's preventing you from moving. I have 7 mirrors to check in a bus. I couldn't move my head right. It just was a bad situation.
And so it really affected your quality of life and your ability to do your job. So we're real excited. Now you're doing better and hopefully go back to being normal.
Yeah.
All right, is there anything else you want to tell your fans out there?
I would say that when you watch his videos, it's a little QVC-ish, but he is not lying. It's all the truth, and you better come and see Dr. Duke because it's worth it. It's worth every penny. I'm not afraid that I paid for this, and even if I don't get any of that back, it's totally worth it. And I don't know if anybody's ever called you a tool before, but you were definitely the tool I needed to get my own self fixed when nobody else would.
I am God's tool, so I try to do what God asked me to do and help people.
Right.
So that's okay to be a tool. Well, congratulations.
Thank you.
And I'm very happy for you.
It's a good handshake, right?
Yep,
Yes,
very
it
good.
is.
Yeah. All right, take care.
All right.
I'm Dr. Ari Duke-Majan with the Duke Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Duke Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Duke laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4mm cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And Actually, you could see the tears on the discogram that I did, and they were big. And we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Duke laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right. Well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Duke plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I was having extreme pain. I was turning to when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right. Let's get you out of here, okay? Go enjoy the beach or something.